Why does Medicare have to be so confusing? Hi, I'm Craig Smith with Craig Smith Insurance Group, and I'm a licensed independent insurance agent based in New York. Now, our agency specializes in Medicare, and I wanted to make this short video to help you understand how Medicare works in simple terms. It can be extremely stressful coming up on that 65th birthday with a huge healthcare decision to make. So sit back, turn up the volume. I'm going to hop back behind the computer, and over the next 15 minutes, I'm going to arm you with the right questions to ask when this pushy salespeople come a knocking.
All right, so let's get started. Turning 65 is obviously when you have a lot of Medicare choices that are going to come on your way. So I first wanted to give you a little bit of information about myself. Who's Craig Smith? I'm born and raised in Merrick, New York, licensed since 2010. My national producer number is 1052999. Currently licensed in New York, Virginia, Florida, Pennsylvania, Oklahoma, Tennessee, Texas, and West Virginia, and I've been an independent agent since 2010. Now, what we're going to cover today is original Medicare. There are four parts. Your two choices that you have is Medicare Supplement or Medicare Advantage plan. Now, what does Medicare cover? What is a Medicare Supplement plan and how to compare? What is a Medicare Advantage plan and how to compare? A Part D, which is also called the prescription drug plans, and important enrollment dates. Now, a few benefits I offer. First, the information is unbiased. I am on the ground. I specialize in Medicare, and the information you're going to get is going to come directly from what Medicare posts. We will review your coverage every year, and there's no cost for my help. So let's dive in. This is the Medicare and You for 2021. It's from the United States government, Medicare.gov. If you haven't got one in the mail, you can order one, or you can go online and download it. So most of the information from this 15-minute video is going to be coming directly from Medicare and You. Now, Medicare Basics, there are four parts to it. There's Part A, which covers your hospital insurance, and Part B, which is your medical insurance, and Part C is what they call the Medicare Advantage plan, which is kind of like an HMO and PPOs, and the Medicare Part A and B, and sometimes Part D are all included. And then, of course, you have your Part D drug coverage. Now, original Medicare Part A, it's eligible for everybody at age 65. There's no cost for Part A as long as you work for 10 years or 40 quarters. It works with any hospital that accepts Medicare nationwide. Your medical benefits will restart after you are out of the hospital for consecutive days. Once you've used your lifetime reserve days, they will never be available again. So you can see by this graph on the screen, it shows what a 90-day inpatient hospital care would cost an individual. It would cost you almost $12,000 if you were in the hospital for 90 days. That's what you would pay. Plus, you have the 60 lifetime reserve days, which is that costs you $742 a day. So if you added all that up and you were in the hospital for almost 150 days, that's $56,488 is what it would cost you. Now, original Medicare Part B, you're eligible at age 65, but can delay if you continue working. Premiums start at $148.50 a month, but could be higher depending on income. And it works with any doctor or facility that accepts Medicare nationwide. Now you can see the Part B deductible for 2021 is $203. After you've paid the Part B deductible, Medicare pays 80%. You will be responsible for 20%. If a doctor does not accept assignment, the doctor may charge an excess charge of 15%. Now, deciding how you want to get your coverage. You have original Medicare Part A and Part B, or you can decide if you want a supplemental coverage, which is called a Medicare Supplement or Medigap insurance plan, and then you would need a Part D prescription drug plan. Or you can have a Medicare Advantage plan, Part C, like an HMO or PPO, and Part C does combine Part A and Part B, and usually Part D. Secondly, if you decide that you need to have drug coverage and the plan doesn't offer it, you can purchase an additional drug plan, but most Medicare Advantage plans cover drugs. So there probably wouldn't be a need to add anything extra. Now, Medicare Supplements or a Medigap plan, these are some really important facts. You must have Part A and Part B. You pay monthly premium for your Medigap policy in addition to your Part B premium. Cannot include prescription drug coverage, so you need to purchase it separately. And costs vary by company and policy and may go up as you get older. Now, that's not in every state. New York doesn't have that, so you don't have to worry. Now, they have what's called guaranteed coverage. So when you turn 65 or you first enroll in Medicare, Part B, you have 6 months to choose a Medicare supplement plan without answering any health questions. After those 6 months, insurers can ask health questions and can decline your application if they wish. New York and some other states, they're guaranteed issue, so the health questions don't come into issue as long as you've had credible health coverage in the past. Choice of doctors and hospitals is accepted at any doctor, hospital, or facility that accepts Medicare nationwide. It's standardized coverage. Insurance companies can sell you a standardized policy identified in most states by the alphabet. So it's A, B, C, D, as you can see, F, G, K, L, M, and N. And this means that different companies can charge different premiums for the exact coverage. Again, the coverage is identical from company to company. The premium is set by the insurance carrier themselves. This is from the Medicare and You booklet, and it shows a chart of the different Medicare supplement plans. You can see it goes A all the way through N, and then you have C and F. C and F, though, if you're Medicare eligible before 2020 only, you can get it. If you're Medicare eligible after 2020, it is not available to you. So you would just have the A, B, C, D, G, K, L, M, and N. What we found is most of our clients, the N plan offers a very well portfolio of coverage for you. And as you can see, it shows you here what Medicare pays, what the plan pays, and what you would pay. So on the Medicare, the hospitalization benefit, I highlighted it there, what your cost would be. Part B for Plan N, it shows you what Medicare would pay, what the plan pays, and then also shows you what you would pay. So you would have to pay on the Part B, you pay Part B deductible of $203. But once you've been billed for the $203 for a Medicare approved service, that is for the year. So it's a one-time $203 cost. Now, Medicare supplements or Medicare gaps, you had to compare. The monthly premiums on a Medicare or a Medigap supplement plan, you could see will range quite a much, from $190.22 all the way up to $325. All the plans are the same. It's just what the insurance carrier wants to charge. Now, Part C, which is the Medicare Advantage plan, how do you compare? You have plans that have monthly premiums of $20 to $0 to $98 to $39. So you can see that there is a lot of variety amongst the different plan premiums. But you need to check, are your doctors part of the network? The drug formularies, which is how the drugs are listed by each carrier. What are the copays? Out-of-pocket limits can change every year. So that's important because you don't want to enroll in a plan that maybe your doctor doesn't take unless you're willing to change doctors and to make sure that your drugs are covered. Now, a Part D prescription drug benefit, Part D prescription drug plans may have a monthly premium and an annual deductible. Prescription drug benefits work off a calendar year, typically January 1st through December 31st, and the plans use a formulary. This lists the individual drugs covered by a plan. All the plans have what's called tiers. Most plans place drugs into tiers or levels from 1 through 5. Each tier has a different copay and a different coinsurance associated with it. Now, prior authorization and quantity limits can be put in place by the insurance companies. So some drugs require you or your prescriber to contact the drug plan before you fill certain prescriptions. Your prescriber may need to show the drug is medically necessary for the plan to cover it. Quantity limits say how much of medication you can get at a time. And then you have step therapy, which requires you to try one or more similar lower cost drug before the plan will cover the prescription drug. Now, enrollment dates, you have original Medicare and Part D or Medicare Advantage. You have 3 months before your 65th birthday, the month of your 56th birthday, and 3 months after your 65th birthday. Original Medicare can be done online at ssa.gov/Medicare. You can do it in person at your local Social Security office. You can call Social Security at 1-800-772-1213. Or if you're a railroad employee, you can call 877-772-5772. Now, if you're already receiving Social Security benefits before you turn 65, your enrollment is automatic. You'll get a Medicare card in the mail 3 to 5 months before your 65th birthday. Now, important enrollment dates for a Medi Supplement or Medigap plan, which is sometimes called, you have a 6-month window. Most carriers let you lock in a price for your Medicare Supplement plan up to 6 months before your Part B effective date. Once your 6-month open enrollment ends, you may have to answer some health questions, and this means you can pay higher premiums or be denied coverage. So what's next? Option 1, start calling 30 different places to get rates and information. Or option 2, let us do it all for you. We'll do the heavy lifting for you for free. So you can either call us at 917-740-1895. You can send us an email at craigsmith@csmedicare.net. And make sure for you to check your email and your text messages for a confirmation. Thank you.